So one of the most common things that we get asked in our practice is, I've been diagnosed with Parkinson's disease, what do I do next? And because it has been utilized so much for the last few years, everyone is kind of funneled into this, I should do the LSVT BIG program. The LSVT BIG stands for Lee Silverman Voice Therapy Program. It started actually as a speech therapy program, and now referred to as LSVT Loud, to focus on emphasizing using a bigger voice, thinking, increasing those cognitive synapses to make your brain think a little bit louder. I, as a physical therapist, specialize, as well as my wife, Dr. Sam, we specialize in focusing the LSVT BIG, which is the therapy program that focuses on the movement patterns instead of speaking. Now, what I want to kind of get across is that just because you've been diagnosed with Parkinson's does not mean that you need to do the LSVT BIG or the LSVT Loud program, especially those who are recently diagnosed. That is, however, not to say that at some point throughout your journey that you would benefit greatly from this program. It is, however, recommended. I recommend that once you do get a confirmed diagnosis, is that you do have either movement specialist, whether that's your neurologist or even a physical therapist, assess those movement patterns and do a quick assessment and see if in your current functional ability, if you benefit from that LSVT BIG or that LSVT Loud program, or if it's something that you can kind of hold off and focus in those later years as the disease itself progresses. With that being said, again, almost everybody at some point will benefit from the LSVT BIG program for Parkinson's disease. If you have been diagnosed with Parkinson's, or you have some Parkinsonianism or Parkinsonism, sometimes referred to as the symptoms affiliated with Parkinson's, but you don't actually have the disease itself. And something that I've noticed in my several years of practice is that many of my patients that have absolutely no neurologic deficits, they have no foreseen symptoms related to Parkinson's disease, actually still benefit rather greatly from the LSVT BIG program. So that is anyone who's having a little bit difficulty getting out of a chair, getting out of a bed, moving around throughout their day-to-day function, getting in and out of a car seems to be a big problem for most patients at this stage. All of those patients, whether they have Parkinson's or not, do benefit from this program. So if you have any questions about the program, I'm going to attach another video at the end of this, which is going to go a little bit more in depth with the program. That is, maybe you don't need the program, or maybe you don't need the program now. During this video, I cannot tell you if you need the program. That would take a full in-depth assessment from a qualified healthcare professional that is able to work with the patient directly. Thank you.